What's up, guys? So, today I want to talk about finasteride. So, if you don't know what finasteride is, it's basically a DHT blocker you get prescribed. Can be for enlarged prostate. Most people take it to counter male pattern baldness. Basically, you take it, and more than anything, it's just going to prevent further hair loss. So, people start thinning, they usually hop on this. But there's also a lot of horror stories out there if you just start Googling it. And it's got a lot of people afraid. People ask me all the time, like they're afraid to take it. They ask me, what do you think about these studies and this data? So I'm going to kind of check, do that today. So the pros of it are that you take it and it prevents further hair loss. And if you've got like thinning baby, where they turn to like those baby hairs before it goes bald, it can kind of stop that, kind of reverse some of that if you catch it soon enough. And on the flip side, the listed side effects will be things like possible erectile dysfunction, depression, things like that, which is honestly not that uncommon for any kind of hormone-based, medicine. Now, if you Google it and start reading these horror stories or ask around for these horror stories, people are going to tell you it's like 99%. You take it, you're going to have permanent side effects for the rest of your life. And that's the kind of thing I don't like, man, is all that hearsay. That's really what most of my videos, if you notice, are based around. It's just the idea of kind of countering the hearsay that's out there. So, if you look at the actual studies, they say 2 to 4% will have side effects. Typical numbers. And let's say you go with the more aggressive, these that kind of the anti-finasteride or post-finasteride syndrome type people. Even they typically say upwards of 15%. Yeah, 15% is kind of high to have possible side effects. But let's dive into that 15%. Because number one, there's no actual studies and data to say 15% of people will have permanent side effects. Let's say that 15% of people will have some side effects, and then maybe of that 15, less than 1 is going to have actual lasting side effects. So I first heard about finasteride from someone I work with, and he's been taking it since like 2005. No side effects. My dad's taken it for years. No side effects. I've taken it for like 2 years. No side effects. You know what I mean? So that's the point I'm making is I've never actually met anybody in person who's had side effects, let alone permanent side effects. So the point is, when you read online horror stories, you get in that small the vocal minority percentage. There is no data to suggest that there is this permanent side effects. Everything suggests, just like a typical medicine, if you take it and you have side effects, you hop off, 3 weeks later you're good to go. And if you're in that small percent, of course there's that risk. You could be in that small percent. So you always do have to keep this in mind. I'm not saying it doesn't exist. I'm saying it's not, it doesn't cause it. It isn't like you take it and you get it, like people make it out to be. So then it's like, well, what's the theory behind what's happening then? And I think it was a good theory by Dr. Rand. If you don't know him from the Muscle Insider Ask the Doctor series, he was in Prescription Thugs as a brief scene as a doctor they asked and talked to. So as he pointed out, he was like, he writes 10,000 prescriptions for it, and 5 or 10 people have these actual issues like this. That's not enough. That's not data to say that this causes this. That's that small percent where there has to be special circumstances. So his theory in it is, if you're taking, if you get testosterone's here, and it's dropped, let's say from 800 to 500 over the last few years, but you don't really feel, much different. You haven't really noticed any hormone issues, but you got that slight drop. And let's say, you got your DHT. Well, now you're taking a DHT blocker, and now you've sunk your DHT. And now that testosterone number has really showed up because you were getting a little boosted from that DHT. So, that's a popular theory that he lays out. You can always look up, his videos. He's mostly talking steroids, but he's, got that in there. So anyway, so that's kind of a popular theory as to what's causing it for that, small, that rare percent. So the point I'm making, though, is to not be so afraid of it. Go to an actual doctor, man. Don't Google it, because you all see those memes. You got a cough and you Google it, and next thing, you think you're going to die. You know what I mean? And if you go to a doctor, let me save you some embarrassment, because I brought up the stuff that you read, because I was scared of it. He looked at me like an idiot. Just straight up. He was like, so you're coming in here going to ask me about online self-reporting people with no statistical numbers to back that up, no studies to back it up, or proof. And I was just like, well, yeah, I'm kind of stupid. So, but the point is, if you want to take it, you should be aware of that possibility, those possible side effects, don't go Googling these horror stories. Ask around the people you know in person who have taken it. Ask them if they've had side effects. More importantly, you go to a doctor. Go to your doctor, tell him your concerns. He will then tell you what he recommends if you should take it. But for the vast majority of people, you take it. You know, if you have side effects, you hop off. It's not a big deal. But don't go Googling it, and don't go buying the online liquid stuff. Because you are kind of asking for trouble. You don't know what that is. You know, it's an actual prescription. So, you know, don't get into that. It's like $40, even if you don't have insurance that'll cover it. And Costco is like $15. You know, so there's really no need, you know, to try to get around it, man. Just go to the doctor, get a prescription. It's not a big deal. So, hope that helps calm some of the concern. Hope it helps. And I'll see you guys later.